The government has introduced a new tax relief scheme which will allow us to claim money back on certain health treatments and consultations provided by pharmacists. The measure has come into effect from today. Tánaiste and Finance Minister Simon Harris saying it'll be formally included in the finance bill later this year. And to find out more about the scheme and how beneficial it'll be, I'm joined by a pharmacist. Who better to talk to about this? It is Audrey Rochford from Rochford's Pharmacy. Good morning to you, Audrey.
Good morning.
Thanks very much for being with us. So, seems like pretty good news, this new tax relief, allowing people to claim money back on certain healthcare services provided by pharmacists. Can you just give us more detail? What exactly has changed? What has come into effect from today?
Early in January, there was new regulations passed whereby we were allowed to get involved in a scheme called common conditions, where now pharmacists can prescribe like the way your doctor can prescribe. Now, we're limited in what we can do. There's
about 7 or 8 of them, isn't there?
Yes, yeah. That's exactly it. There's 8 common conditions. But if you take something like, say, impetigo, we can prescribe a topical antibiotic for that. In the past, you would have had to go to your doctor, and your doctor would have given you a receipt for the service. In this case, you can now use a receipt from your pharmacist and be able to claim back tax on it. So it's the same way as you would from your doctor. You would be able to use a receipt in the same way to claim back tax. So that's what has been introduced.
Okay, so I mean, positive news for people. Do people need to do anything differently when they visit a pharmacy if they want to claim that relief?
No. What they should do is, we give receipts anyway, and they should keep those receipts. But often we find when it's coming to the start of a new tax year and the end of the previous tax year, you can get a report from your pharmacist of all your medication expenses and all of your, your prescriptions as such, and this will be included on it in the report. So it's really just keep doing what you're doing. It's up to us to give you the receipt, which we would anyway, and you can claim for that. Now, because people have been doing this process since January. Well, at least we have. If you didn't get a receipt that said common conditions at the time, because there wasn't clarity about whether you could claim back tax relief on it, just go back into the pharmacy and they can reissue you a receipt. It's just something that we do routinely. There's nothing special about it.
And we would have spoken at the time, or not with yourself, but we would have covered at Morning Focus those 8 common conditions. But for people who may have missed it or not be aware, and you've touched on impetigo, what are the other conditions? I think is it vulvovaginal thrush is one of them too? Yes.
There's 8 of them, and there's shingles. Which is quite a common condition in actually older people. There is conjunctivitis, impetigo, oral thrush and vaginal thrush. There's cold sores. There's allergies and rhinitis, which would cover things like hay fever, and we are coming into the hay fever season soon. And then there's what they're calling uncomplicated urinary tract infections, cystitis. So there's 8 specific conditions with very specific criteria associated with them.
Okay, and in terms of the common condition service, how, from the pharmacist's perspective, I mean, it's great for the customers because, it saves going to a GP, and it's great for the GPs as well because, it lessens somewhat the queues outside their door. From your side of the counter, has it been working quite well? Has it added significantly to your workload in any negative way?
No, well, it's been sort of a slow starter, to be honest, in that. And
has there not been much uptake on it? Or?
No, it's been slow because I'd say people don't all know about it, and also the criteria is quite strict. For example, we can only treat women with urinary tract infections. It's much more unusual for a man to have a urinary tract infection, and so they should go to their doctor. For example, I was speaking with somebody yesterday, and she phoned me up and she felt she had impetigo, and obviously I needed her to come in, and I said, do you have more than 3 lesions? Because if she has 4 lesions, then I can't actually treat her. So there are, I suppose, strict criteria. So
it's sorry to cut across, Audrey. In terms of when you say strict, is there a feeling that in some cases too strict?
No. I think we're learning. Maybe it is in time. perhaps, for example, for treating thrush. Now, this is my own opinion as opposed to say anybody. Fish, where we the products that we can give, many of them are available over the counter already.
Yeah.
So we can do a little bit more, but not an awful lot more. Whereas, if I said in that Impetigo case, we can give the topical antibiotic, and that is a real game changer. Or say I had another lady who had a urinary tract infection, and she had an early flight the following day, and it just made that she could start her antibiotic because she really didn't think she was going to be able to get her doctor's appointment that late in the evening. And it's been working, but I do think we need to let people know of its availability, and like all pharmacists like ourselves have websites and people can phone their pharmacist in advance, but sometimes doing it online and trying to book it probably gives you a better idea whether you meet the criteria or not.
Well, look, not to be patting ourselves on the back here, Morning Focus, but I'm going to do it anyway. Where there's the Common Conditions Service or this new tax relief scheme, we're certainly doing our bit here to highlight it for people, but you have touched on the more awareness. I don't want to say lacking, it makes it sound like there's been barely any awareness, but I did wonder if this new tax relief would encourage more people to use their local pharmacy as a first point of contact for minor health issues, but it just sounds like there needs to be more awareness out there in general, not just of the Common Conditions Service but also the tax relief scheme.
Yes, I think that is it. And to be fair, the government actually did put out a press release on this. Like, we got all the main people, Jennifer, Carol McNeil and all of that. But I think people are just getting used to it, and what they may not realise is that if you have an item that is covered under the medical card, even though you have to pay for getting the consultation, the item is covered under the medical card if you have a medical card. So that lady that I met yesterday, she had a medical card and we just processed it as a medical card prescription. So she just paid her €1.50 as she would for her medicine if it came from a doctor. So I think that might be a message that needs to go out to people as well, that even though they might have to pay for the consultation, the medicine is covered under the schemes in the same way it would be for a doctor's prescription.
So if someone comes into the pharmacy with one of the 8 conditions covered, in terms of the consultation process, how would that work? What would they go through? Or does it depend on what condition they come in will dictate the type of process?
I suppose for us, we're in the process of trying to do an online system where people will know whether they'll be suitable or not at the start. But if they come in and present themselves, it would involve either completing electronically or written form and having an interview with the pharmacist in the consultation room, where you go through a set of criteria to ensure that, I suppose, we have gone through the process in the same standardised format according to the protocol, and then resulting in you getting a prescription, or maybe you need to be referred, or maybe it's not what you thought it was in the first place in that. And so based on that, then the different pathways are followed. I suppose it depends on, the timeline really depends on when you come in and how busy the pharmacy is at the time. Like, if you come 30 minutes before closing, it's a very busy and stressful time, I have to say.
You're dreaming of your dinner at that stage.
Yes, in that, and it's just, look, people all look, my own, I'd be the same myself, probably coming at the last minute. But there's lots of people coming at the last minute. That's actually the thing. But if you come like in the middle of the day, or it should be an awful lot easier. So like if you took the pharmacy next door, you could just come in anytime, because generally we would be able to resolve, do the consultation with you, or you might have to wait a short amount, but we're usually fairly on hand to do it.
Oh, well, I mean, look, anyone listening, we can all empathise with that kind of, late in the day being faced with a significant workload when you're already dreaming of home time. Nobody wants that. But to finish on, I suppose, a positive note, Audrey, I mean, look, the tax relief scheme positive for people, but from the pharmacist's perspective, the service and the scheme, over 90% of community pharmacies offering it or expected to offer it. I'm sure pharmacists in the past have felt they could play a more significant role in terms of evolving primary health care, or could and perhaps should. Is this welcome generally from pharmacists?
Totally.
You're being afforded an extra significant level of responsibility and perhaps respect that comes with that then?
Yes, yeah. I think actually as a group of people, as a professional group, we're ready, willing and able. And while I'm maybe of an older generation, I have like 30 years experience looking at this. The newer pharmacists are so well trained, so well able to talk to people. I think we're more than ready for it and more than capable, and I think we could do more if we were given the opportunity.
Okay, well, look, positive stuff. Just make sure you don't call into Rochford's 30 minutes before the doors are due to close, okay? No. Go easy on them. I know, I'm only messing. But we do appreciate you coming in to us. Audrey Rochford from Rochford's Pharmacy.
Thank you.
Thank you very much for joining us on this on Morning Focus.